If you get yellow fever, this can have life-threatening consequences. Yellow fever is active and spreading in different parts of the world, like Africa and South America. In this video, I'm going to go through everything you need to know about yellow fever, including how to recognize it, how it's transmitted, and how to protect yourself against yellow fever. And at the end of the video, I'm going to cover some common questions that my patients ask me. Starting with the most common question, what is yellow fever? Well, yellow fever is a virus transmitted by mosquitoes. Primarily two types of mosquito called. These mosquitoes are commonly found in Africa and parts of South America. After you get bitten by an infected mosquito, you don't get symptoms straight away. Usually it takes around 3 to 6 days after you're bitten by an infected mosquito to get symptoms. Generally, mosquitoes love to breed in hot, humid environments, so you can find them in tropical rainforests and around lakes or still water. What are the symptoms of yellow fever? The early symptoms include headaches, muscle aches, fever, chills, and joint aches. These early symptoms usually last between 3 and 4 days. Many people will start to recover from yellow fever at this stage, which is the early stage. However, some people develop the more serious complications of yellow fever. These are the symptoms you need to watch out for in the more serious phase: feeling confused or dizzy, having seizures, vomiting, tummy ache, and reduced urine output. You also might get bleeding from the mouth, nose, or eyes. Around 15% of people who get yellow fever will enter the late stages, and this is what we need to prevent. How do you know if you have yellow fever? Well, if you've been traveling and you've been in a high-risk area and you're not vaccinated, you will need tests for yellow fever. You'll usually need a blood test to detect the virus. How is yellow fever treated? Well, the reason we encourage vaccination is because currently there's no cure for yellow fever. As doctors, when someone has yellow fever, we'll try to support them by helping them to fight the virus. Ways we do this is by giving oxygen, fluids, blood transfusions, and treating any other infections they may develop as a result of yellow fever. So, how do you prevent yellow fever? Well, we advise people to take the yellow fever vaccine to prevent getting yellow fever when you're going to areas where there's a high risk of yellow fever. For some countries, it's mandatory to have this before you enter, so check where you're traveling to. Watch my video on the yellow fever vaccine for everything you need to know. My other top tips include preventing mosquitoes biting you as much as you can. So taking the appropriate insecticide, making sure you're wearing the appropriate clothes. So usually that involves wearing long trousers and wearing fully sleeved t-shirts when you're in areas where there's a lot of mosquitoes. Make sure you use mosquito nets at night and you close your windows to stop the mosquitoes getting into your building. Thank you for watching this video, and if you can click subscribe, it really helps my channel to keep growing. And if you can write down any questions below, I'll get back to you.